broadcast is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is Tuesday, May 21st. The Developmental Disabilities Administration welcomes you to the DDA Educational Series webinar. Today's topic is the role of the Coordinator of Community Service. It's the CCS. Before we begin, I'd like to go over a few things about the webinar. This webinar is open to all stakeholders and will be recorded and put on the DDA website. All participants will be in listen-only mode. There are two options for listening to the webinar, by computer and by phone. And if you have trouble hearing, you can switch to either mode by clicking on the appropriate button on the webinar panel in the audio section. There are handouts for this webinar, which you can find in the handout section. If you are listening in by phone and would like them emailed, you can email me, Donna Will, at donna.will@maryland.gov to receive them. We will record today's webinar, and if you send me an email, I can send you a link to that. We will be putting the educational series on the DDA website, and all the sessions are going to be posted soon. Questions can be typed in the question box, which is in the webinar panel. They will be read and answered out loud as long as they relate to today's topic. So we have several staff presenting today. We have Rhonda Workman, Director of Federal Programs, and also Dr. Yamonja Smalls, Director of Coordination of Community Services. So for now, I'd like to introduce Rhonda Workman. Hi, good afternoon.
Hi, Donna. Thank you, and good afternoon, everybody. For today, our agenda is we're going to provide an overview of DDA, and then Dr. Smalls will be sharing information about our targeted case management, our service referred to as coordination of community services. Then she's going to provide information and an overview of the various roles and responsibilities, and then some great helpful information related to choosing your CCS. First, we'd like to start with our overview of our administration. And so the Developmental Disabilities Administration, we believe that all people have the right to live, love, work, learn, play, and pursue their life aspirations in the community. We do this by partnering with people with developmental disabilities and their families to provide supports and resources to help them in living fulfilling lives and reaching their goals. We provide our coordinated delivery service system to enable children and adults with intellectual and developmental disabilities and their families as they work towards self-determination, interdependence, productivity, integration, and inclusion in all facets of community life across their lifespan. We recognize that we are one of many resources, services, and supports that are available to assist individuals and families as they build their lives towards their vision of the good life. Our administration supports the lifespan. We support children, adults, and families. As we begin to talk about our different services and supports, we'd like to remind everyone that as we're looking towards that trajectory towards individually defined good lives, that there are a variety of resources and tools that can be used. This slide is a demonstration of the integrated STAR that has a variety of different integrated supports that can be accessed and used for planning as people seek their good life, such as being employed, community membership, owning an own apartment, practicing faith, and such. Our service delivery systems are one of many listed in the eligibility-specific supports. But again, it's important as we look at services and supports to consider all resources, including the person's own personal strengths and assets and relationships to help support that good life. And now I'd like to turn it over to Dr. Smalls.
Good afternoon, everyone. We're going to spend some time just talking about coordination for community services under targeted case management. Next. Coordination for community services. The Developmental Disabilities Administration's coordination of community services assists people with intellectual and developmental disabilities and their families in learning and gaining access to resources in their community, planning for their future, and accessing needed services and supports. The DDA has approved CCS agencies in all of Maryland's 4 regions. At times, based on staffing capacity, a CCS agency may not be available to take new referrals. But as you can see listed here, we have more than 15 agencies that are available to provide supports for all of the citizens of Maryland. We're going to spend some time talking about the roles and responsibilities of the CCS, and there are many. The CCS's job is to connect people with resources in the service and the services that they need. Services are planned and delivered in a manner that encourages staff sufficiency, health and safety, real community participation. They support a person's goal to live a good and meaningful life. Often referred to as case management by Medicaid, the coordinator plays a vital role in the delivery of services for people with developmental disabilities. Usually referred to as the CCS, their main job is to connect people to their resources in their community. The CCS support a person's goal to live a good life, a life that is meaningful to them. Next. Helping the person to identify what is important to them, their preferences for, and what is important for them. So that balance between what is important to and for is always something that the CCSs are challenged to address. Additionally, the CCS is helping the person to identify, again, what's important to them and for them, their needs. Connecting a person to those resources, services, and supports through their community, DDA, and other systems. Some community resources could include medical services, educational services, housing assistance, public transportation, and social activities. The CCS assists in the walkthrough and the development of the person-centered plan with their person and their identified support team. The CCS is really charged with making sure that in all ways they're looking at all supporting documentation, they're looking at the individual record, helping to complete the health risk screening tool, SIS tool, looking at restrictions, any issues with human rights. Again, the role of the CCS is to compile these necessary documents to help the person develop and identify the key outcomes towards maintaining and developing a trajectory for their good life. As the facilitator of the PCP, the CCS works alongside of the person and their support team, making sure to have clear discussions that help to develop the PCP that is meaningfully describing what is important to and for that person. It outlines the outcomes that lead the person to living their good life. The CCS works collaboratively with providers, identifying those that are approved to provide those needed services. The CCS also has an important role of monitoring progress and follow-up with the person and the providers responsible for the service delivery to ensure that the person continues to move towards achieving their determined outcomes with goals. The monitoring process includes visits to the person's home, spending face-to-face time with them to assess their progress, observation in provider settings, and their CCS is responsible for reviewing documentation supporting the delivery of that service. The CCS has a very key role in the person-centered plan development process. And I know we just moved past the slide. They are conducting ongoing exploration and discovery. They ensure the outcomes line up with what is important to and for the person for their good life. They help the person to share their plan with others. They are responsible for entering the PCP and all supporting documentation into the LTSS system. They meet at least annually with the person and their team to review and update that PCP. And they enter all of that service authorization into LTSS. They complete the cost detail and self-direction budget tools. We touched briefly on their monitoring and follow-up responsibilities, but they are responsible for quarterly monthly, in some cases, visits and phone calls to the person, checking on the overall status and progress of the person. They are responsible for observations and review of provider documentation, detailing service delivery to the person, and they're also responsible for satisfaction assessment of the person and their family with overall DDA services and those received by the CCS agency. While this is not an exhaustive list of all the responsibilities that the CCS has, the DDA recognizes the instrumental and challenging role that they manage, as they ultimately are responsible for supporting the person in achieving a plan towards living their best life. Now we're going to talk a little bit about how you choose your CCS. First of all, it's all about you. What do you want to do in life? For the people that we're talking about, we want to make sure the CCS is really asking the questions that really support developing a picture that tells your story. Do you want a job? How do you want your CCS to work with you? Choosing a CCS agency may seem challenging, but it's important to remember that first, this really is all about you and what's important to you. Think about the things that you want to do in life. Are there places you want to go? Who are the people you want to spend your time with? Are noisy environments frustrating for you? Again, do you want a job? How do you want your CCS to work with you? Do you prefer having meetings in quiet places in the library? Would you prefer having the meeting in a place where more of your family can access you?
Dr. Smalls, can you let us know when you'd like us to move to the next slide?
I'm sorry. Next slide.
Okay, so we're going on slide 20 now, right?
Yes.
Thank you.
So next, you're going to want to investigate. If you're in the process of choosing your CCS, you want to investigate. You want to ask questions so that you're able to make an informed decision. The DDA provides information about each of the approved and active CCS agencies on its website. And you can see the link here that will take you to a page that will list out updated lists of information that provides an overview of each of the providers, CCS providers. Additionally, you may know that other people and families who are receiving CCS support, and you may want to ask them questions and you may ask them for recommendations. While you may choose to visit agencies' websites to get a basic overview of those services and find out more about what they specifically provide, you may find out more by giving the agency a call. You might even want to consider asking the agency some very specific questions about how that CCS will be able to work with you. How do the CCS respond to the things that happen after normal business hours? It's really important to find out, who do you contact? Will they be responsive? Are they accessible after normal work hours? How often do CCSs change at your agency? Is there high turnover? Some of those challenges may create situations that make it challenging for you to connect with your CCS. So asking those questions helps to get a better understanding of how they provide services, and it does impact the adjustment to building relationships. Next slide. Additionally, you're going to review those CCS profiles again on the DDA website, get recommendations from other people and families, and give that agency a call. Next slide. Some of the questions that you may want to ask involve those that will help you to kind of narrow down your decision making. What supports do you need? What supports do I need? Or questions you may ask yourself. What is important to me? Again, how do I want to work with my CCS? And what are some major life goals I want to achieve? These are important because you want to find out if the CCS agency and the CCS that you're assigned is going to be able to help you to achieve those goals. Next slide. This is a review of some of the points we've already discussed. We're going to move to the next slide. When we get to the final stage of making a decision, again, you're going to want to compile some of that information you've already collected and really decide which agency best addresses and understands your needs and wants. Which one is going to be capable of doing that? which show dedication in helping people reach their life goals. These are, again, things you may find out through interview, observation, and some of the questions that you may ask when you talk to a CCS or the agency themselves. Which agency has the knowledge to support you? It is a good idea to include your family, close friends, and other members of your support team when you are ready to make your decision. Review your interviews and take time to evaluate how you feel about the responses you received. After all, the CCS agency will be responsible with helping you to understand and move through the DDA system, which can at times be very challenging. Do you feel like they listened to you? Were your thoughts and feelings important to them? Did you feel respected and your needs valued? Next slide. What happens if you need to make a change? It is important that you assess the quality of services you receive from your CCS on a regular basis. Is your CCS agency meeting you and your family members' needs? When things are not going smoothly between you and your coordinator, there are several steps that you can take. If you attempt to talk to your CCS and are unsuccessful, call and speak with your CCS's supervisor. If the relationship cannot be improved or issues remain unresolved, the supervisor may assign another CCS within the agency to support you. Next slide. At any point, you may feel that your CCS agency is not a good fit for what you or your family member needs right now. There is never a penalty or a negative consequence to choosing another agency. For example, if there is a time where there may have been a time where you decided that your family doctor was not the best fit for you and just couldn't meet your needs. Perhaps they had little experience supporting a person with disabilities. As a result, you found a new doctor who could serve you better and decided to go with her. It's your right and your choice. You need to do what's best for you. The DDA encourages this. Reasons for changing agencies may include your CCS may be hard to reach, maybe they're unfamiliar with some of the community resources, or there may be some other challenge. But it may just be as simple as you moving to another region that's not served by that agency. There may be multiple reasons. Again, there's never any penalty for making a change. The CCS agencies work very hard to maintain positive, supportive relationships with each person that they serve, but sometimes it just might not be a good fit for you. Next slide. If you need to make a change, the process is very simple. First step, after you've already attempted to contact and talk with your CCS, potentially the supervisor, and if you've landed on deciding to make a change, you'll just need to call your DDA regional office and let them know you wish to choose another CCS agency. Next slide. Call your DDA regional office and let them know you're ready to choose another agency. If you've already chosen your CCS agency, DDA will send you documentation to sign. Next slide. If you need to make a decision or you need to know your options, a choice form and choosing a coordinator of community services provider, person, and family resource guide will be made available to you. Next slide. Additionally, you will ask yourself several questions throughout the process. At some point, you may decide as you're reevaluating and evaluating your services received that you are happy with services, but there are a few things that might improve the overall delivery. A couple of things that we're going to continue to ask involve the following. First, are you checking to see if you have a copy of your person-centered plan? Do you know your CCS's roles and responsibilities? Do you meet with your CCS at least once every 3 months? Does your CCS communicate with you regularly? The DDA is going to be providing some regular assessment to really assess your satisfaction with the services that you've received from your CCS. Next slide. In each of the regions, you have a point person, your CCS lead, that is responsible for fielding any questions that you might have. Please feel confident in reaching out to them if you need additional information that's going to be helpful in you're making a decision about choosing a CCS. Again, our CCSs work very, very hard to provide excellent services and support of the people who are receiving them. We want to encourage you to develop overall good communication and continued relationship with this team member. And if for any reason you need to make a change, please feel free. It is your choice. And they are listed on the DDA website under the link currently provided. Next slide. Are there any questions?
Thank you, Dr. Smalls. Our first question is how to get the Choosing a Coordinator of Community Services guide.
So the guide that we just referenced will be uploaded to the DDA website, and the link will be updated and included in this presentation.
Great. The next question is how to get a copy of the feedback form.
So the feedback form, and there are two different satisfaction surveys that will be sent out. One that will go to the participant, the person, so that they can respond to their interpretation and understanding of the services provided, and one to the family or support team that's maybe the authorized representative for the person. Those will be mailed out directly to you, and a member of the DDA team will follow up to ask further questions if clarification is needed. So those will go out directly to the person and their authorized representative.
Dr. Smalls, can you share some of DDA's strategy in providing professional development for our coordinators of community services?
Excellent question or comment. The DDA is really committed to ensuring that our CCSs are well equipped to do the challenging jobs that they have. And so we have recently had an approved RFP that looks at the development of a training curriculum for all of our CCSs. It covers issues from cultural competence, person-centered planning, service authorization, conflict resolution, all kinds of things, but basically it is a 13 module training strategy to equip our CCSs. The plan is to develop this into a curriculum that would lead to certification, and even though 13 modules are initially identified, we're looking to add several more to ensure that CCSs are well equipped to do all of the components of their responsibilities. The plan is that it will be completed, at least the first part of the 13 modules will be completed by this upcoming summer.
The next question is how long does it take to transfer to another CCS?
That's a great question. In some cases, it could be as quickly as a few days. The most challenging part is making sure that the record is transitioned to the new identified provider. Again, we detailed that the steps were as easy as calling your regional office and indicating that you're interested in switching providers. If you already have that provider identified, it's a very smooth process. If you need time to, again, do an interview, ask questions, look at information on the website, it may take a little bit longer. But again, the DDA regional office does make that process fairly simple and quick.
Our next question is any suggestions on how to bridge the gap between making the initial referral and starting services? It seems there is a missing link between referring our students sometimes. So it sounds like this is a question coming from our school systems in terms of referring potential transitioning youth to the DDA.
Excellent question. And so that always ends up being an issue of concern, and we want to do a better job of making sure that our CCSs are starting early in the process, connecting with coordinators in the school system to make sure that they're in preparation for the transition earlier than when we have typically done it in the past. So it's an excellent point. We do have some strategies to make sure that the CCS is connecting with the school in our TY fairs and presentations to make sure the conversation is happening earlier.
And then just to add to that, in terms of initial referrals of students to us for services and supports, or anybody at any age that may be seeking services and supports, you know, our first process is that application to the DDA, and for which we will assign a coordination agency to go out and do that initial support for the application. And then once eligibility is determined, then the person has the ability to choose the agency they want to work with. You can refer back to a previous webinar that we did related to the DDA application process in terms of how to make that initial referral and the steps that happen after that before someone is determined eligible and put on the waiting list. The next question is, when will the guide be mailed out or the forms be mailed out?
So
about the satisfaction form.
Satisfaction survey.
Can you review that again?
Yes. So the satisfaction surveys initially are supposed to be sent out at least twice a year. Because we have not had a consistent process, initially the CCSs were sending those out to people in services. We're moving towards DDA managing that so that we can really review and do a systemic analysis of issues that come up with specific participants and people in services. We really want to make sure that we're understanding what families' needs are and concerns so that we can make some programmatic changes that will affect overall support that CCS agencies may need, and hopefully be able to use some of that for guidance. So those satisfaction surveys, again, will be sent out at least twice a year, but maybe started at a quarterly basis just so that we can get a good baseline of data, since DDA hadn't previously been analyzing that. It was being managed by the CCS agencies. The guide that we referenced that details ways to choose your CCS, again, that will be available on the DDA website for download, and we'll discuss a mailing strategy. At this time, it would be uploaded to the website.
Thank you. Dr. Smalls, can you talk about some of the concerns or challenging with CCSs in terms of turnover?
General issues with turnover, there are multiple, but I do think the exciting part is that we've identified that some of the resources that would make it easier for CCSs to really manage some of those challenges really come down to there being some good training curriculums developed. Each of our CCS agencies have been doing a great job at providing some training within their agencies. We are just looking to really streamline that to ensure that all of our agencies are in line with some of the new direction and guidance that is coming from DDA. So that is a process that I think is we've got well underway, and the CCS agencies are directly collaborating in the process of that development. Several of the CCS agencies are sitting in a committee where they provide feedback. Other issues that do impact turnover, as we know, are caseload ratio sizes, the number of people that our CCSs are working with. And when there is turnover, it results in slightly higher ratios. And so we want to make sure that, you know, with that very specific challenge, that there are ways to really address how we can improve recruitment for those agencies. And that is a challenge. I can't say that we have a clearly identified solution for that, but it is something that we're looking at and want to rule out issues with resources being available being a deterrent for CCSs remaining with an agency. Because we don't control the pay tier for each of those agencies and it may be slightly different within them, we know that that comes up as one of the reasons why there is turnover. But we are excited that there's some opportunity to onboard new folks, and if it does result in folks transitioning to new opportunities or potentially promotion within agency, that we find ways to potentially recruit additional students, new employees, again, new CCSs that can move through the system with a clearer onboarding strategy that will result in them remaining on board. This is a challenge, and we're always looking for new opportunities to really strengthen and hopefully maintain their ability to, maintain, or I'm struggling here because this is one of our challenges. How do we support CCSs remaining with their agencies? So again, we look for other opportunities to really support it. Open to suggestions.
The next question is, are coordinators of community services coordinators employed by DDA?
No, the DDA does not employ the coordinators. You may have heard term the CCS squad mentioned. We have hired 14 staff that are employed at the regional offices, all of which have significant CCS experience, case management experience, but their role is to really partner and collaborate with the CCS agencies, helping them to really understand some of the issues with performance measures, hopefully being able to increase compliance and providing technical assistance as they are learning and navigating our LTSS system, especially in the preparation for our next release come July 1st.
Right, so the coordinators of community service agencies are private or nonprofit agencies that are enrolled to become Medicaid providers and provide these functions on behalf of DDA, but they are not employed by DDA. So
Thanks for clarity.
The next question is, in self-direction, do CCSs work with participants in developing a budget when participant has elected not to use a support broker?
Great question. And with some of our tightening up and restructuring of self-direction, we know that there's going to be some additional information to provide clarity on the roles of the CCS broker, the person in service, their family, and support team. The CCS is the facilitator of the PCP process with the person and services, and their job is to ensure that that person-centered plan really truly reflects that person's story. So as part of that role, the CCS is the one who develops that budget in direct communication with the person and their support team. The broker does provide feedback just like any other person on the team, but as the broker is the person supporting the employer responsibility, they are not responsible for developing the budget.
So the answer would be yes, that the coordinator of community services would be assisting with that if a person didn't choose the support broker. They would provide support.
That's a shorter answer.
Yep. Can you talk a little bit about who decides which CCS is assigned to a participant and that initial contact when someone first contacts the DDA for services? So this would be under our initial application assistance and how CCS agencies are assigned.
Okay, so the CCS, that initial process after the choice form has been sent out, the person has identified.
Dr. Smalls, this is before the choice form. So someone calls DDA, they're unknown to us, and we would assign a CCS agency in terms of a random selection. Can you talk about that?
Okay, so when DDA gets a call, this person is assigned to a CCS agency randomly for a comprehensive assessment. Once that assessment is completed, and at that point, the person isn't choosing the CCS who is doing that assessment, but after it's complete and eligibility determination is made, the person receives a choice form so that they can decide which CCS agency they're interested in working with. at that time it would be good for them to take a look at the guide. They may already have relationships with others that will make that decision-making process easier. But at that point, they'll be receiving a choice form. They will be able to make that decision, and then the person, the regional office will be identifying that agency as the CCS provider.
Great. We had a suggestion to put the satisfaction survey form on the website, so thank you for that suggestion. Another question relates to, is there a good number of individuals on a CCS caseload? So can you share what DDA standard is for CCS caseloads?
So we really want to have caseload ratios of about 1 CCS to about 35 to 40 people. We do have an average that's a little higher than that, and very some isolated situations just due to turnover where it's what would say unacceptably high. But that said, the ratio that is acceptable and we believe is supported is 1 to 35 to 40.
Great. The next question is, in the proposed 13 module training for the CCSs, is that 13 days, 13 weeks?
So the way we have at least determined time increment for that training module is based on each individual module. So they're based on hours of training, and right now it's not even leading up to about, I think, 6 days. We are working with the coalition and identifying additional training that we know our CCSs need. The CCS coalition weighed in on the initial 13 modules that were approved. Again, we agree that there are additional trainings that really need to be rolled into the certification for CCSs. For example, we did not include the waiver training, and we have since done a significant amount of waiver training for all of our CCSs. We are doing a significant amount of training around LTSS and service authorization. Those were not separate modules included in the initial certification modules that we're developing with the Columbus organization, is the group that is working with us directly.
Great. And just to reiterate, related to the CCS caseloads, our standard is no more, or a 1 to 40 ratio. So 1 coordinator of community services supporting 40 individuals is the DDA standard. Our next question is, what is the role that DDA has connecting individuals and CCSs?
So it's a good question. We touched a little bit on this initially with a discussion about the random assignment of CCS for the comprehensive assessment. Once eligibility is determined, the CCS or DDA will provide that additional documentation that will help the family and person make a decision about which of the agencies which one of the CCS agencies they're interested in working with. They have access to the DDA regional office that can provide additional guidance. But all of the agencies that are currently approved to provide case management, their information is located on the website, and additional, there does need to be an additional update in some of their information, but all of that is available for the currently approved CCS agencies.
Great. Our next question is, when a client is nonverbal, how can families be ensured feedback from the CCSs for a quarterly visit? Is there a requirement that the CCS contact the family member to discuss feedback about the quarterly visit? So, Dr. Smalls, you might want to talk about, age of the participant, legally authorized representative, confidentiality related to that.
Yeah, so that's all. It's always a challenge when someone's mode of communication is different than ours. So in this case, a person who does not use verbal communication, there are other ways that the CCS can communicate with a person, and through the person-centered planning process, we'd want to clearly identify what that is. If it's written, if there are other augmented communication devices that are used in the communication, and then clearly identifying who that information should be shared with on their team. Is it an approved authorized representative, or are there other team members that the person has chosen to share their story with? And we want to make sure that that information is documented. I don't know if I answered the full question there.
Yeah. When will the DDA computer system be operational? My son's PCP conference was held on March 5th, and the CCS has yet to get approval of the document from DDA. LTSS system resist input. Nothing can be done, and January 4th, almost 1/3 of the year is gone. Or 1/4 or 1/3 of the year is almost gone.
Okay, well, the system, and that's a really unfortunate situation. I would be interested in being able to follow up with if I got some additional information. We have had a few there are a few challenges with LTSS when entering PCP information, where PCP dates, the annual dates, have not populated correctly. So there's been a lot of work with our consultant to ensure that those fixes occur. We are already in full process to release on July 1st, where service authorization is going to be included in the LTSS process, but we know that there continues to be concern for those who have person-centered plans who have not yet been entered in the system. Again, this is one of the big fixes that's being focused on. One, making sure that PCPs can be entered for everyone who's currently receiving a service, and our workaround that involved a paper upload process will be eliminated. So prior to our next release, we are continuing to walk through the fixes to ensure that this person's, and it sounds like you're not the only one, but we do want to make sure that those PCPs are entered into the system effectively, and you have a copy of that plan in hand. If we can get that person's name so we can follow up specifically on why they have not yet received, or why that person-centered plan hasn't been entered into the system, I'd appreciate it.
Great. The next question, how are individuals with language barriers such as deaf, blind, Spanish, etc., paired with CCSs? And then a similar question is, are CCS trained to support individuals, or are there CCS units that specialize in certain populations, for example, transitioning youth, age out, military families, and such? So can you talk a little bit about the CCS agencies and their own business models related to that, and maybe questions that should be considered when choosing your CCS?
Yeah, so these are great questions. I mean, these are the kind of investigative questions that when you are looking to work with a CCS agency that you'd want to ask. The DDA website does have each provider's overview of their business practices listed, and each are in process of updating that, may make changes to that on some interval of process or some interval of time. The DDA website is going to be updated to include some changes to providers' overview, but again, that is a place where you can, it's a starting place to review what the CCS's business model is. Some of them may have expertise in different, working with people with special needs, and so that's a starting place to at least begin to ask questions. The DDA website does point to each of those agencies' websites if they do have one. Again, off the top of my head, I'm unable to say which does specifically work with certain populations, although all of them work with people with developmental disabilities. But this is something that we definitely would want to bring back to the coalition, because if they want to refine those statements so that families can further, make a more adequate match for the person that's in services, I think that would be a really positive thing.
Great. The next question, or maybe it's a suggestion, is can we aim for one great waiver training module for CCSs, family, support broker, FMSs, and vendor populations? Can we put it online for the whole team? So before turning it over to Dr. Smalls, I'd like to just share that, the DDA is working on various guides and fact sheets and other tools that we hope will be helpful to inform stakeholders, in addition to these educational webinar series that we're conducting. Recently, the Developmental Disabilities Council, in partnership with the DDA, has put out a request for a company to develop training for individuals and services and family members related to the person-centered plan. And so we can also look at other opportunities to provide additional training and overviews related to the waiver specifically, and always open to additional input and feedback related to that. Dr. Smalls, anything else you want to add in terms of training modules about the waiver program for CCS family members, individuals and services, and other supports?
I think, Rhonda, you really addressed that. I do think that some of the additional training that we have developed for CCSs really needs to be made more user-friendly so that families really can, I think, really enjoy and understand and ask questions that are going to help them better understand the services that may be available for their loved one.
Great. Next question is, can I access my child's PCP on LTSS?
Unfortunately, family members do not have access to the LTSS system. However, at the point that the CCS is working directly with you in the development of that plan, and up until the point where it is about to be approved, you should get a full copy of the person-centered plan and signature sheet so that you have the final both version that's been in the process of revision and then the final authorized plan in hand. On the satisfaction survey, that is one of the questions that we look to make sure we get feedback on, as sometimes folks have indicated that they do not have an updated current person-centered plan in hand for the person and services.
Great. The next one is, after the annual PCP meeting, should the CCS provide a copy of the PCP summary form to the participant for review and signature, or is the participant signature to be captured at the conference meeting and later applied to the LTSS PCP?
No, so that's a really good question. The person should be signing their plan after all services have been finalized in the person-centered plan. So the provider has identified the goals that they're going to be developing, the clear outcomes. All aspects, again, of the person-centered plan are in the draft, and the person signs off after we've received all provider signatures. So ultimately, the person is, while they have reviewed what went out to the providers, they get to see the final draft in its final state, so that there's no situation where they've signed off on something that then might have a revision following their signature. I hope I was clear. They're always going to see the final draft and sign off on the final document, the final PCP.
Thanks. There's a suggestion or comment related to whether additional training modules could be available to participant families in budget development. I think that's a great suggestion.
Yes.
I know we are working with our self-direction framework and have recently conducted some stakeholder meetings sharing our framework and some of the efforts that have been made. We will be sharing information related to self-direction to include a brochure, some fact sheets related to roles and responsibilities for the fiscal management services, the coordinator community services, and in addition to a self-directed handbook for participants that I think will be very helpful. So we can also take this suggestion and look to see if we can create a training module related to that.
Yes.
There's another question. Does the CCS initiate the HRST rating prior to the PCP in coordination with the residential professionals?
So the HRST is done in tandem with, or the PCP, the HRST is done within the PCP development process, because that assessment does inform whether there may be some additional health needs that need to be addressed, services that may address and support that health concern. So it does need to be done in the context of the PCP plan development. It's not done after.
There's a question asking, what kind of education background does a typical CCS have?
So it varies. We have CCSs that have been doing case management for many years, but minimally we do require that they have a bachelor's degree. Many are coming to us with a social work, public health degree, psychology degree, but certainly that background working with people. Again, the amount of training that is already in place within individual agencies to onboard their staff is such that it allows them to really be at an operational level. What DDA is looking to do is add additional guidance and support that even with the basic education that they're coming in on, build upon that so that they can be more effective in the role as CCS, because it does have quite a few responsibilities as we initially covered today.
Great. The next question is, what if an individual is unable to sign, not just physically, but also cognitively? Many of the individuals providers serve are unable to understand what they are signing, and yet services and the PCP requires the individual signature. Obtaining signatures often occur by hands over hand. How should CCS navigate this tricky area?
Well, that's a really good question. I think there's a couple things that we want to consider. We want to make sure that if an authorized representative is assigned to the person, is working with the person, we have a good understanding of how that person communicates, because a signature in this case might not be the best way to affirm their understanding or their agreement with the plan. And so for each person, we have to evaluate that in a person-centered fashion. And if unique strategies need to be put in place to really make sure that we're capturing their understanding and agreement with the plan, we would do that. As far as entering that for LTSS, we would just need to agree what that needs to look like. But I think there's willingness to consider what that person needs, given the fact that people have different needs and as far as how they might agree to the provided service, the discussed service in the plan.
Absolutely, because we all communicate differently, and
Right.
there's different ways to identify a person's choices and preferences, right?
Right.
We've got a couple compliments related to the information. One says, thank you so much for these terrific information webinars. And I'd just like to share, as we're kind of wrapping up here in time, that our next educational webinar series for next Tuesday on May 28th is titled Understanding Appeals and Reconsiderations. So an opportunity to learn about the different options available to individuals in terms of seeking resolution to some of the challenges or disagreements with decisions that have been made. And so we look forward to sharing that information with you next week. A couple more thank yous related to the webinars, and then just a reminder in general that if you have concerns, questions, comments, compliments, or challenges, that we want you to reach out to the DDA regional office. In our presentation, I'm going to put it back up on the slide. Here's the regional office CCS leads that can also provide assistance if you're having some challenges with the CCS agency that you're working with, and our regional directors are also available. So again, we appreciate you participating in this webinar series, and we hope that you'll be able to join us for our next one next Tuesday. Thank you.
This is Marty. Hello?